it's not a catastrophe. Like I really, really catastrophized it for a while, and it's not.
Today we're here with Stephanie Evans. She's an ostomate and a personal trainer, and I think you're going to like her story. Hey, Stephanie, thanks for being here.
Thanks. Nice to be here. Great
All
to
right.
meet you.
Yes, you too. So first, I'd like to ask, how did you come to getting an ostomy?
I always had issues with my digestive tract kind of throughout my life, starting first in all the way back 2005. Um, First, my gallbladder stopped working as it was supposed to be. So I had it removed. Um, but things still continue to decline until 2010. My colon was going really slow. That's the issue. The colon stops working as it should. It starts really slowing down, and that causes ulcers from so much pressure because it gets so full, things just aren't moving as it should, and then it starts to dilate, and then things get worse and worse. So mine got to the point where my ascending bowel actually perforated. So I had 90% of my colon removed, and I had the anastomosis for 5 years. So I didn't have to have a bag at first, but things were terrible for that 5 years, nothing but pain. I was starting to get ischemic at the site, at the anastomosis site where they stapled me together. So I was getting ulcers and lots of bleeding, just lots of issues. So I decided to just go with the bag. I tried everything that I could to not get it, but in actuality, it was the best thing that I did, really. Um, Not to say I haven't had issues since then. I ended up just 4 years ago having to have an emergency surgery due to my small intestine, the stoma prolapsed, and that prolapse caused it to also obstruct because it twisted on the inside. And so it was not going back in. I was actually at work in the hospital in the ED that night and ended up a patient. That's why I wanted to go into nursing, though, initially, because I wanted to be somebody working with ostomates, right? Coming out of surgery, any type of abdominal surgery, even if it's not an ostomy, it's, something else, because I knew what it felt like to be on that side, and it's hard. It's super hard, and it's hard rebuilding. After so many surgeries, you are weak, very, very weak, and there's a lot that you have to do. I didn't realize in the beginning. I just listened to them that I would never be able to lift more than 10 or 15 pounds ever again. I thought I was just going to be weak the rest of my life. I lost a lot of weight, kind of went down a spiral, and got depressed. And I had to really, really build myself back up. And it's hard, but I get it, and if I can help another person do that, it's amazing. That's really why I am on the side of, if you feel like you're in a low point in your life, or if you've been told that you physically can't do something because of a surgery or an illness or an injury, right? It's not always the case. We can, build back up safely and slowly, but it's not a life sentence.
In the last 4 years, when was the turnaround for you? What was the shift that kind of started moving things in the right direction?
My son went to college, and I focused on myself for the first time in a long time. The turning point was definitely that shift, getting into the wellness space. I went back to school for my master's in sports. Also, at the same time, I did a Duke program for health and wellness. So I'm now Duke certified health and wellness coach. I'll be working towards my national board certification pretty soon with that. And I also studied to become a personal trainer and a group fitness instructor. Those things helped me break out of it because I was advancing myself in a space that I always wanted to go to, but I felt like it wouldn't be stable and it's scary, right?
Yep.
I was a mom. I can't get out of this stable job.
Yes.
Um, Healthcare is very stable. The wellness sector is kind of volatile, at times. Especially just first getting started.
Yeah.
And then also I was in Fayetteville, Hope Mills, a small town south of Fayetteville. Really, it's a very small place. It's not health and wellness driven. There's not very many fitness centers or wellness centers. It's military driven, military town. Um, so yes, just changing my entire life helped to change that mind shift. And the fact that I was working on myself physically to get physically stronger. And then I saw, wow, okay, I actually can do this. I can lift more than 15 pounds. I went and saw a personal trainer, and that person got me even further. Um, and I did a lot of working very, very, very hard to get strong, and to gain muscle. And that's hard to do as a 46-year-old woman. So to say that it is possible when you're older as well, it's never too late.
What kind of limitations do you have today with your ostomy and your physical body?
We'll always have that weakness because we have a hole in our abdominal wall where the intestine is. So even though we can get it strong, we can strengthen the surrounding area, we always have a risk of prolapse. We always have a risk of a hernia. And we have other risks that other people don't see: bag leaks, maybe smells, uncomfortable skin irritations, things like that, sweating a lot, worrying about all these things, right? What if being able to feel secure, having the bag feel secure? Because it can feel very vulnerable if it's not secure, or if it might not be secure, or if something might happen and you're in public. Anything can happen. So yeah, there are still challenges that people don't see. And only another ostomate would get it and understand. But there's ways to work with it. And it's not the end of life. And it's not a catastrophe. Like I really, really catastrophized it for a while. And it's not. It allows me to live my life and be pain-free and not sick. So
So through the challenges you've been through, what has helped you the most?
a positive mindset and knowing that it doesn't define me. That mindset has helped me the most, I would say. And then physically, core strength. Um, yeah. And people think straight to abs when you say core strength, but no, it's so much more than that. There's deep abdominal muscle that support the spine and the pelvis. And all the sitting that we do in day-to-day life these days, driving, desk work, things like that, our backs get really weak, our glutes get inactive, and we start to slump. It's the whole weak abs, weak core altogether.
Give me 3 tips real quick just for the
Sure.
for the ostomate who's had their stoma for, let's say, 6 months. What are the first 3 things for core strength you'd tell them to do?
I would start with doing breathing, deep breathing, lay on your back with your knees bent and feet on the ground, and put one hand on your lower abs and one hand on your diaphragm, or like upper abs, and focus on breathing in slowly and then out slowly through the nose. Diaphragmatic breathing really helps with core strength in the beginning. It's very safe. You're not crunching. I would say do not do not do things like crunches and things like that. Instead, do the diaphragmatic breathing and then take that to another level where, like variations of dead bugs. I don't know if you know what those are, but laying on your back with feet, knees bent at tabletop, and then slowly lower one leg down to touch your big toe to the floor and slowly bring it back. So working those lower abs and learning how to really brace the core, navel to the spine, posterior pelvic tilt to put your spine against the floor is very important. And then take it up a notch with alternating your hands with the dead bug. So right arm back with the left leg out and then back up to center like that. And then graduating to planks.
You've been through a lot, so and you've journeyed through it. It's been like 20 years. So when it began, and 5 years ago you had a major issue again, and so it's kind of been revisiting you. What have you learned about yourself, like from where you are today? As you look back, what have you learned about yourself?
I am much stronger than I ever realized that I can do anything I put my mind to. Resilience is everything.
What kind of nutrition advice do you have for the new ostomate?
Be careful. Yeah, be careful. So I remember after my first surgery, I got this whole list of foods. um, don't eat mushrooms. Don't eat raw broccoli. Oh, my surgeon told me beforehand so many times, make sure you cook the heck out of that broccoli because I used to be a vegetarian actually, but I stopped that. I cannot, after this last surgery, I had to get the distal portion of my small bowel removed because of that obstruction. And yeah, I went way too long with that, and my intestine was basically dying. If I had gone any longer, it would have been bad. But so I lost some small intestine, so my digestion is a lot worse. After the first surgery, I was like, well, I was able to eat pretty much anything actually, aside from like raw kale, but anything else I was fine with raw wise. Now I can't eat anything raw veggie. It puts me in terrible pain. It doesn't break down. And no matter how much I chew it, it's something about the fiber. It bunches up and causes obstruction type symptoms. So yeah, I would say be careful because we're all different, right? I mean, I'm even different from the first surgery to this last surgery with how much more limited I am now. Um, it's funny because it used to be said that meat is hard to digest. Meat for me is the easiest to digest, and plant matter is super hard to digest. So, but we're all different. So, yeah, it's all trial and error. I had to figure it out. And after lots of trial and lots of pain episodes and obstructive episodes, you figure it out and you get tired of eating the same stuff that puts you in pain. So you got to figure it out and stop eating what doesn't work for you.
Give me some tips for skin irritation. How do you deal with it?
I love the crusting technique. I use it every time I change,
Wow.
just to prevent skin irritation. But also, I'm in North Carolina where it's super humid in the summers and I'm outside a lot. I'm very active. And of course, I like to run. So I do tend to get skin irritation in the summer because it's so much friction. But actually, I realized too that the ostomy belts help because it keeps the bag off the skin. So that actually helps for less friction
Okay.
and making the bag feel more secure. It's not bouncing around. So I really love that. So I would say that as a tip, and then the crusting technique. I actually, this is going to sound funny. You're going to laugh, but I got some fungal spray. It's a spray powder that people use for like foot fungus, just over the counter, because I noticed that sometimes the irritation, maybe it's fungal, I'm not really sure, but where the crusting, the powder, ostomy powder is just not enough. But that fungal spray, I tell you what, it burns at first, but then it has a cooling effect, and the next day it's good.
How do you feel about dating with an ostomy?
I think dating with an ostomy is fine. I just haven't sought it out, I guess. I keep myself really busy and I've been doing a lot of changing and building in my life. So I kind of always felt like I need to be in a place where I feel stable and in balance with myself and before I seek out dating. So, but to say that, I believe if you find the right person, it shouldn't matter or it wouldn't matter. Um, it can be nerve wracking thinking about dating for sure, or how to bring it up, or when to even tell them, right? But I also feel like when I do take that leap, it's going to be fine.
You initially were diagnosed with you had multiple digestive issues, one of which ended up being a perforated bowel, which led to your ostomy initially. So, what advice would you have for somebody dealing with a perforated bowel?
Don't delay. Um, I kind of let it get bad. Don't let it get that bad. If you things are not moving as they should be moving and it's getting worse, seek help. Go see a doctor sooner. Don't let it get to the point where your bowel's perforating. That's super bad. Okay. That was an emergency department visit. And then a hospital stay with 3 different types of antibiotics running through an IV and hydration and everything else. So don't let it get to that. Biggest tip.
And then let's follow that same question up with what advice would you have for the new ostomate as they approach and engage with their new life?
Take things in stride and give yourself grace. Um, Try not to get frustrated because it's a whole new thing that you have to learn. Everything is different. Your body is different. It'll never be as it was. So, yeah, give yourself grace and be kind. You'd be kind to a friend, be kind to yourself.
Hey, Stephanie, thanks for being here today. We really appreciate you sharing, and we wish you the best of luck.
Thanks. Happy to be here.